Okay, so that's sale and lease back in a nutshell. Pretty much covered everything to do with sale and lease back in that section. Now, as an alternative to sale and lease back, perhaps you're not interested in selling lease back. You don't want to sell the surgery. You want to keep hold of the asset that you've got and you've worked very hard for over the years. So perhaps putting a lease in place suits you better. So upon retirement, you keep the surgery, you become the landlord, and you lease it to the remaining partners, or you lease it to the incoming partners that are coming to take over. So if that is the case, there are some important things you need to know when putting a lease in place. So one of the first things that I've touched on already is make sure that you've got a specific NHS GP surgery lease. Very, very important that it's not just a template lease that you've got off the internet, because the issue is with standard leases is they're just between the landlord and the tenant. When you're in an NHS premises, you've got a third entity. You've got the NHS themselves. You've got the NHS that need to be involved in the process of putting the lease in place, need to be involved in the rent reviews and things, and it needs to be clearly stipulated what their involvement is. So very, very important that you get a specific GP surgery lease. Then it's very, very important that lease gets approved by the district valuer and the NHS. So the district valuer will undertake what we call a value for money report, and then the NHS will agree whether to accept that, whether to approve it, whether they're happy with the terms of the lease and the rental liabilities that they're taking on for the premises. Then it's very, very important that you clearly state the landlord and tenant's responsibilities. So who's going to be responsible for things like the repair and maintenance obligations, etc. There may be conditions in the mortgage when you're putting a lease in place. So it's important that you contact your mortgage provider again, because you're changing from an owner-occupied premises to a leasehold premises. There may be covenants or restrictions in the mortgage that prevents you from doing that. So you may be voiding the mortgage effectively by becoming a leasehold premises. So again, just worthwhile picking up the phone to the mortgage provider, making sure they're okay, making sure they're aware, making sure they're happy with you changing from owner-occupied to leasehold. And then there's going to be some tax implications as well. There's tax implications for every single thing we do these days, and putting a lease in place is no different. So just make sure again that you get specialist primary care accountancy advice